My name is Osama Elattar, specialized mainly in shoulder surgery and foot and ankle trauma. I started thinking about becoming a doctor when I was 14 years old, and I think the first motive for me was my dad passing away from a rare disease. He got something called metastasis of unknown origin, which is like almost 1% of cancers. We really didn't get to know the primary, and he passed away without knowing what he really had. And then 2 years later, my mom broke her hip and she had to have a hip replacement, which was complicated, and she had to have a revision hip replacement. I think those two things were the starting motive for me to go this route and decide to become a doctor. When I was in medical school, when we do the clinical rotations, I just fell in love. Once I went to ortho and I started reducing fractures and dislocations, I felt that's what I was created for, and that's the way I should go. Before coming to the States, like 12 years ago when I came from Egypt, a big defect in my home country, Egypt, in the field of ortho was there was no foot and ankle surgery. So my passion was mainly foot and ankle, but I also have additional interest in sports medicine. And lucky enough, my training was in very good institutions where I got double fellowship training in sports medicine and shoulder surgery. Then I finished with my foot and ankle fellowship training at the University of Pennsylvania, which is basically what I wanted to do from the beginning. So my main interest, I would say, 75-80% foot and ankle, but I also do a lot of shoulder replacements and shoulder arthroscopy. I do believe that the foot and ankle pain especially gets overlooked. A lot of patients assume this is something that's just gonna work itself out and it's gonna disappear with time. Unlike hips and knees, where they really immediately seek medical advice, I think you should consider and take foot and ankle pain more seriously. It starts with foot and ankle pain, and then it starts throwing off your knee. Then they start getting hip pain, then they start getting back pain, and they start seeking advice for those other things, not for the foot and ankle. They start seeing a back doctor, and then the back doctor says, oh, it's not your back is fine, it's the way you walk. And then we start going down from the back to the hips to the knees, and we finally realize it's really the foot and ankle from the get-go. People really overlook foot and ankle pain and think it's something simple that will eventually work itself out, but mostly it doesn't.